Hello, my name is Heather Stewart. I'm the Executive Director of Kentucky Harvest out of Louisville, Kentucky, and we've been doing food rescue since 1987. I am excited to lead this panel today, but mostly you're going to be hearing from our speakers. We are going to talk about diversifying your funding stream. So I'm pleased to introduce today Robert Lee from Rescuing Leftover Cuisine in New York City. Amanda Bank, who is a program officer with the Center for Healthcare Strategies, which is based out of New Jersey. And most of you know Josh Weiland from 412 Food Rescue. So we're going to start right in with Robert and let him tell you about what they're doing for earned income.
Awesome. Thank you so much for having me here today. Super excited to be here. Flew in this morning and I realized, wow, there's just so much I want to talk about. But I'm going to try and keep it terse to the point. And really, I just want to answer people's questions. But truly, on the next slide, I believe, just a quick kind of introduction. And on the next slide, just a little bit of a background. Personally, I like to just start with my own personal background just because it gives a little bit of context. And it gives a little bit of a kind of just a background of kind of, the decisions that we've made. Really, for me, it really started on a very personal level, and my parents came here just looking for a better life. They were just like a classic immigrant story, and essentially, they didn't know the language, so they struggled. And my dad was a civil engineer in Korea, my mom was a bank teller, but unfortunately, they couldn't find jobs like that here, and so they just ended up being, my dad was a supermarket manager, my mom was a homemaker, and I grew up just thinking like food insecurity was normal. I thought everyone was going through it. And it was only when I went to kindergarten when I realized, like, cute things like people cutting off the ends of their sandwiches and like not eating the crust and things like that. That's when I realized, like, wow, this is not normal. And for me, growing up like that, I focused so much on just obviously just rescuing food whenever I could, but also just focusing entirely on a career in finance and getting our family out of the cycle of poverty. And so I ended up graduating from NYU and going to work at JP Morgan in asset management. And I just, was so focused on that. But after about a year of working at JP Morgan, I quit my job to work on rescuing leftover cuisine full time. And that was back in 2014. And since then, a lot of things have happened. And just a quick kind of, introduction of the organization. We're a food rescue organization. We bring excess food to homeless shelters. We started because we realized that great organizations like City Harvest and Food Bank existed in New York City, but they had a minimum pound requirement where they wouldn't go buy for food donations below, at the time, 50 pounds, but they increased it to 100 pounds. And so we fill in that kind of niche, smaller amounts of food, working with the cafes and restaurants and things like that. And we rescue the food on foot in New York City. Essentially, on the next slide, I kind of wanted to talk about and focus a lot of the time really on earned revenue because you might be wondering to yourself, how do I do this? Like, it just is one of those things where it sounds great, in theory, but it's really difficult, I think, to take that first leap and start charging. Especially when you first hear about it, it's like, so the food donors are giving you food and they're giving you money? It sounds like it's like, it doesn't make any sense. And so I wanted to provide a little bit of a brief history about the organization and how we got to start to charge and have this new revenue, line item on our books, and then talk a little bit about how you can start. Basically, for us, we started just providing the food rescue service for free. We just, we launched right into it. I quit my job, and I was just rescuing food. And after a while, after about 2 years, actually, it took me a long time, I realized that a lot of the incentives weren't there. Like a lot of our food donor partners, they would do this out of the goodness of their hearts. They would want to, do good and be a part of the community. But sometimes they wouldn't tell their workers. The managers, the owners would just be like, yeah, I'm down. And then they would forget to, tell the new night manager, hey, you got to package the food before they leave. And so we saw this like downward spiral where essentially the night manager would just not know. They would just throw out the food, our volunteer would go, or I would show up, and the food would be tossed. And we would just be like, this is great. And then the volunteer would be upset because they came and they're not doing anything. And then, of course, the volunteer is upset, so they don't come the next week. And so that's the week, of course, that the restaurant actually does package the food. And so it just becomes this downward spiral. And what we decided to do was we started to charge so that we could align those incentives. If our restaurant partner, forgot to package the food, we can say, hey, like we have to charge you because we came by. We have to pay this rescuer for their time. And if there's something that we did wrong, let's say our rescuer decides they're going to go party instead, then we can issue a refund. We can make it right so that the restaurant can continue to do and trust in this service, in this professional, reliable level of service. And of course, back in 2015, we had no idea what we were doing, and so we started charging per pound, actually. And we thought that was be like the fairest way to do it, right? Like carting companies do it, and different groups do it. And we thought that if you rescue or donate a bunch of food, we should have bigger transportation methods and charge more because of that. Unfortunately, that didn't work out so well because our restaurant partners and our food donor partners don't really know how much they're actually going to be donating, as you all can attest to probably. I see a lot of nods. And essentially, we saw that people would be like, oh yeah, let's sign up. It's only going to be like, what, $10 a pickup, whatever. And then it would be like huge amounts of food. And they would be like surprised by the invoices. And so we decided to change that, and we quickly changed that to charging per pickup. And we started at just $10 a pickup. We wanted it to be nominal. We wanted to cover the cost of a rescuer. And back in 2015, it was a lot easier to just pay rescuers for $10 a pickup. Obviously, we've increased that since then. We do pay our rescuers $15 a pickup now. But essentially, it was a way for us to kind of align those incentives and allow for us to cover our costs. And so that's kind of just a little bit of the history. I'm happy to obviously answer more questions, and things have evolved over time since then. But I think the primary question that people probably have is, how can you start, right? How can I start? And I just wanted to provide a quick few bullet points of like how people can really get this going. Number one is you can start with a survey, just like asking your food donor partners, what is how do you value this, right? Like money is obviously just a measure of value, right? And obviously this is something that's super valuable in our communities. And so how much would they value this service, right? Like how much time would they spend otherwise looking for a place to donate this food, right? Starting with that survey allows you to kind of almost do a little bit of an icebreaker, essentially. You can send out the survey. There's no harm done. We're not officially, saying or launching this new earned revenue strategy or anything like that. We're just collecting information, right? And it allows for the food donors to just say, hey, or actually think about it and be like, actually, this is a huge value add, and this allows me to get enhanced tax deductions, and so this is what I would pay, and things like that, right? And essentially, you can, I mentioned a bunch of things like you can cite inflation, obviously, bit of a buzzword now, but lots of things are increasing costs like logistics, and there's all kinds of other factors at play, right? The second thing that you could do when you get started is to grandparent your existing food donors in, right? So what we did was we didn't start and just like tell all of our food donor partners right away, hey, we're gonna start charging. Good luck if you can't pay, right? What we did was we like told them over time, like, hey, like right now, let's say it's October 2024. Starting in Q1 of 2025, we're gonna start to do this thing. We're gonna charge new food donor partners $10 a pickup or whatever, $5 a pickup, $20 a pickup, whatever you want to choose. And essentially, you can tell your food donor partners, hey, like, we really appreciate your partnership over the years. It's been incredible. And so, for the first year, for the first whatever length of time, we won't charge you. We'll basically help you find that value. Maybe when you do your taxes in March or April or whatever, we can help you with enhanced tax deductions. We can make sure that you can find the value in this so that you can find the budget, whether it comes from your marketing budget, your cleaning budget, whatever budget it comes out of, and I'll help get that budget for us to capture that value. Finally, I think there's a bunch of things that you can do in terms of your language to the food donor partners. I always like to say for new food donor partners, Our model, is very similar to like tuition for colleges or a museum admission. It's very normal. It's very doable. Nonprofits do it all the time. We do charge for our services, and it's completely. I had a bunch of other slides about like IRS rules, obviously, that you should follow. That like net earned revenue has to be associated with your mission, things like that. But you can say things like mandatory donation or like expected donation if you want to soften that language, right? Like this is something that allows us to do the work that we do. It's not going to fully cover the costs, and it's just one of those things that helps align the incentives and really helps you grow organically as well. So with that, I'll just finish up there, but really appreciate the time, and I'll pass it over to the next presenter.
Thanks, Robert. I'm Amanda Bank. I'm a program officer at the Center for Healthcare Strategies, and today I'll be talking about how food rescue organizations like yourselves can leverage Medicaid dollars to diversify your funding. So we can go to the next slide. Just a little bit about CHCS. We are a nonprofit based in New Jersey, but we work with stakeholders nationally to strengthen the U.S. healthcare system to ensure better and more equitable outcomes for those served by Medicaid. And so while we do a lot of different types of work, we really work across Medicaid implementers to help implement Medicaid more effectively. And a lot of the work that I do is thinking about how to incorporate social needs into Medicaid, particularly food and nutrition, and how those services can be sustainably financed. Next slide. So just a quick primer about Medicaid, since I know that this is a pretty new sector for a lot of you. Medicaid is a public health insurance program for low-income and disabled folks in the U.S., and it is jointly financed by the state and federal government, but administered by the states. And so there are certain core requirements that all states have to follow that are set by the federal government, but beyond that, states can leverage different authorities like things called state plan amendments or waivers to make changes to their Medicaid program. And this can be like increasing populations or how much to reimburse providers. And so because of this, every state Medicaid has great variability compared to other state Medicaid programs. And so as we say at CHCS, if you know one state Medicaid program, you know one state Medicaid program. However, the federal government does pay for at least half of the national cost of the Medicaid program. And so because of that, they have serious influence over the program. And periodically, CMS, which is the Centers for Medicare and Medicaid Services, which is the federal agency that administers the federal portion of the Medicaid program, they'll release guidance encouraging states to address different things. So on the next slide, most relevant to you all, in recent years, the federal government has really been encouraging states to address individuals' health-related social needs, which includes housing, case management, and nutrition. And so I'm not going to cover everything on this slide, but really just want to illuminate how much interest and momentum there's been by the federal government for states to address individual social needs all the way since January of 2021. And it's no problem. Most recently, in November of 2023, CMS released this framework of HRSN services that are considered allowable under certain Medicaid and CHIP authorities. So that's a lot of Medicaid jargon, but basically what that means is under this framework, states are pre-approved to offer certain nutrition services under Medicaid, and the states will be ensured sustainable funding for those services under the different authorities. And so there's a slide that shows what the different authorities are, but they are called in lieu of services, CHIP Health Services Initiatives, HCBS waivers, and 1115 demonstration waivers. And I'm sure maybe you've heard of none of them, maybe you've heard of some of them. 1115 demonstration waivers are honestly the one that most states are leveraging to offer a comprehensive slew of nutrition services. So I'll dig a little bit into the 1115 demonstration waiver in case that's what's being used in your state. But basically, the 1115 waiver is an opportunity for states to innovate their Medicaid program and to receive additional funding and flexibility for those services under the 1115 waiver. But in response to the 1115 being approved, the state has to adhere to pretty rigorous evaluating and reporting requirements. And so this is to ensure that the state like creates an evidence base for these services long term so they can be implemented within the Medicaid program outside of the 1115 waiver, since 1115 waivers are pretty like time constrained. They are usually approved for like 3 to 5 years. And so the goal is that after you build this evidence base of, say, nutrition services for 5 years and show that this will be a positive outcome on folks' health outcomes and for like the spending in the state, then they can be implemented as like a full-time benefit like an MRI or like a knee surgery or some other more like common health system benefit. So the services that were cleared by CMS under that framework were nutrition case management services, which is like connecting folks on Medicaid to other public federal nutrition services like SNAP and WIC. They include nutrition counseling and instruction, home-delivered meals or pantry stocking, nutrition prescriptions, and grocery provisions. And then some states, like Massachusetts, have innovated even beyond those pre-approved CMS services to include things like providing the nutrition service to the whole household rather than just the person that is eligible for that service. And that's really with the understanding that a food insecure parent is probably going to give their medically tailored meal or their produce prescription box away to their kids before they would eat it themselves. So there's a lot of really cool innovation happening across states to implement these nutrition services. There are currently 8 states approved for 1115 waivers under that 2023 November guidance, 11 states that were approved prior to that framework being released, and 6 states with waivers pending. And I know we're in Pennsylvania. Pennsylvania does have a pending waiver that will likely be approved very soon. And so if you're thinking to yourself, oh wow, we offer those services that I listed, or we could easily increase our capacity to offer those services and tap into these Medicaid dollars, but we don't know where to start. That's what I'll lay out next. There is some slides that show it as well, but hopefully I got these slides after and can dig in a little more. But basically, first you're gonna go to the state Medicaid website in your state and see if there is a waiver that's being utilized by your state to cover nutrition services. This is gonna differ depending on what state you're in, but it might be an 1115, it might be an in lieu of service. So after you determine that there is a waiver authority being utilized by your state to offer nutrition services, then you want to dig into what, how the state defines nutrition services and the eligible populations that are covered. Again, this is going to vary in each state depending on, oh, we can go back 2 slides. Perfect. So we're on step number 2 right now. So first you're gonna see how your state defines the nutrition services and the eligible populations. Again, this differs in every state, but if you are reading through that like 1115 waiver and you see that your state covers like produce prescription, grocery provision, medically tailored meal, case management, and you're like, oh, I can offer those, or the populations covered are things like pregnant people, high-risk children. Sometimes the gating criteria for providing a medically tailored meal is just screening positive for food insecurity, which I'm sure all the folks that you serve, that's true for. If you determine that this is something that you want to dig into a little more, then you need to understand how nutrition referrals are being made to community-based organizations like yourselves. So again, I know I keep saying this, but this is going to differ in every state. In some states, the healthcare sector is going to contract directly with CBOs like yourselves. So like you'll create an MOU together or a memorandum of understanding, and then you'll create that contract and go back and forth to get referrals from patients in the healthcare sector to your services. In other states, they're leveraging something called hubs, which are these like neutral third-party entities, and they're taking on a lot of that like administrative burden with the understanding that this is totally new for the healthcare sector to be partnering with the social services sector. And so the hubs will do a lot of that like administrative work. You can also look at your state Medicaid website. They often have a lot of resources and webinars geared towards CBOs to understand like how these referrals are being made. Go to the next slide. So after you decide that you want to get involved, you understand how these referrals are being made, then you need to take internal stock at your organization and think about your capacity and infrastructure and how you might need to increase your capacity and infrastructure to take on this additional work, as well as this additional pool of clients that are coming into your food rescue organization. So I do want to call out that under most of these different waiver authorities that states are leveraging, like the 1115 waivers and the in lieu of services waivers, they have infrastructure funding set explicitly aside for CBOs like yourselves. So you can tap into funding there to get money for infrastructure. Also, if your state is one of the states that is leveraging these hub models, like these third-party conveners, hubs also often have money that is available to CBOs to increase infrastructure, like increase staffing capacity, to train staff on how to bill for Medicaid, which is a totally new language. And then finally, if you're okay, we're good, we can totally increase our capacity to do this additional work, then you just need to make those partnerships with the CBOs in your area, or the MCOs, which is healthcare Medicaid jargon for the healthcare organization in your area, the MCOs that are offering nutrition services. So that's truly just Googling which healthcare organizations are in your area, calling up provider relations and saying, hey, I see that you're offering nutrition services to your patients. I would love to be one of the providers offering these services. How much are you reimbursing for the service? Because you need to make sure that it is going to be a positive return on investment for your organization. And that might be a longer term ROI as you ramp up your service to offer this. But in the long term, this has been proven to, for many community-based organizations, be an amazing source of additional funding and revenue, in addition to the grant funding that you're all very used to. So if we go to the next slide, I think you're going to get these slides after, but I linked to a bunch of pretty relevant CHCS resources that could be helpful to organizations like yourselves. And then on the next slide, there's some other resources from other organizations that do really good work in this area. I'll just call out the ROI calculator that an organization called Health Begins developed, which is for CBOs to see if a partnership with the healthcare system is going to produce a positive ROI. And then there's a link there for a state tracker to see which waivers are approved in your state, so you can see if your state, for example, has an 1115 available. So I know that was a lot, and hopefully there'll be time for questions after, but thank you all for listening, and I'll pass it off.
Hello, everyone. My name is Josh Weiland. I'm Vice President of Operations at 412 Food Rescue. Go to the next slide. It's great to be here. It's great to have this opportunity to engage with everyone. Just a little bit about myself and my work ethos and what we're working to apply at 412 Food Rescue operationally. I like to think of myself as a reformed sous chef from the avant-garde dining scene. A lot of my work ethos, a lot of my skills was forged within that demanding realm. So I really try to take that into the way I look and way I apply myself to the work now. Education-wise, I have a BS in sustainability from Chatham University. My why, which I think is deeply important for everyone to understand and unique to everyone, is I'm a father and a husband of 2 young boys, and it's really important for me that my boys understand and see me practice my values and exercise and move the world in that direction. Those values that I'm constantly working and making decisions out of, whether that's my personal life or my professional life, are curiosity, discipline, and being wholehearted, which is maybe just a fancy way of saying I try to be genuine in everything that I do. Going to take the time today to speak more from the programmatic side and what 412 Food Rescue is doing with our programs to bring earned revenue into our organization. So zooming out from an individual programming and thinking more program scaffolding, what is the structure that we look to build here and what do we measure our programs against? We always want to understand our pro formas with any of our earned revenue models. So creating that specific and itemized understanding of all of our costs, just as Amanda said, so we can understand what is our ROI. Not that we hope, what do we need it to be within an organization? We want to have an intimate understanding with that. I'm a big dream. I like to think big, but then I like to think pragmatically after that, be a pragmatic individual. So let's have a big idea, and then what's the first step that moves us one step closer to that idea? So I'm going to try to thread that throughout this presentation. I give you some really tactical things that you can take back with you. So within that pro forma is be sure you include your de minimis rate, right? This rate that will include all of the other services that go with any one program, all the other things that feed that, not just the operational costs or the consumable goods, but the marketing that goes along with that, the development time that goes along with that. That de minimis rate was historically 10%. In October, they urged it was urged to move that to 15%. So whatever your programmatic cost is, add 10 to 15% to that to cover the additional costs that are going to come along with that. Your programs can be used to fill your operational gaps. So within your deliverables, right, creating a clear a la carte list in a concise form. What are you actually putting out in the world? What do you want people to choose from? What are you trying to charge them for so they can understand that as quickly, as efficiently as possible? Within that list, that also allows you the ability to avoid mission creep and know your worth. It's okay to hold those boundaries and say, no, what are you good at and what is maybe pushing you outside of your true mission. The beautiful thing about what we do is we work in food. The tough thing about food is it's everywhere. So we apply in a lot of different ways, and all of your organizations have very specific nuance that are unique to you. And you have to go through your own process of understanding and categorizing where those strengths lie and where you want to put your resources to. We talk a lot operationally about where do we put the least amount of resources that create the most amount of impact. So how are we creating the most with a stretched team? And then automation, right? We are living in this age where automation is accessible to us. So as you create this concise, clear deliverables, and you're thinking about where your resources most needed, what elements of that can you automate? What throughout your onboarding process doesn't actually need to be a human one-to-one interaction that you can move any potential donor or corporate source through as efficiently as possible and put your resources to where they're the most valuable. So I just snagged a picture of our corporate sponsorship, corporate partnership slide to illustrate that as how we begin filtering individuals into our organization, mainly corporate individuals. All of our programming is run through volunteering. Humans are a huge value chain for us. And we really want to understand that because we put a ton of resources in there. What I believe about our operation too is we do a lot well and we deserve to be paid and earn revenue for that. So understanding that input is extremely important. So just some of those programmatic revenue models that we're currently executing and where they're at in their life cycle. Our Good Food Project. So this project was born out of that operational hole, that intention and impact gap. We were rescuing food from large distributors. We were showing up to nonprofits with maybe a more monogamous donation or a large amount of something. And they said, wonderful, I have no staff, I have no kitchen. What good is this to our organization? And we recognized a gap, so we used a program to fill that gap. We now take those large donations. We have a production kitchen in Millville. We cook them into a reheatable meal that we put in the microwave or the oven that is also housed in a compostable container. So food insecurity is likely to be just one resource insecurity that any end recipient is going through. Good Food Project meals look to address that, whether it's skill insecurity or time insecurity. You can now have a from scratch, nutritionally dense meal that is deeply accessible to you. What we see as the opportunity in this work is entering the food as medicine space, Medicare, Medicaid. I joke with Amanda whenever I met her earlier. I want to be her best friend. I want to learn all of her tricks. I see a ton of opportunity here for food rescue organizations. We believe that not only can rescue food be a service to someone or be vital to someone, we think it can affect health outcomes. So understanding that next step is really important to us and something we're aiming this program towards. We're looking to build that closed loop referral system within our initiatives. So if an MCO comes along, has a constituent that could benefit from this, that we can now directly begin to quantify our impact in the community. Not only is our food being redistributed, our food is being redistributed to a population that's becoming healthier because they have access to our food. There's a lot of opportunity in this. We're really excited about this. We think that it can be a wonderful next evolution, a depth of impact with our programming. We have our Farm Share program. So this program utilizes farming partnerships to build a curated product. That is a tailored fresh grocery bag. We use this partnership to entice corporate partnerships and individual partnerships. So in 2024, we brought this program back, not just simply aimed at people buying an individual share, an individual bag, but you could also purchase a bag that we would then redistribute within our network to a nonprofit in an area that we knew need was real. We sold 205 shares and 55 sponsorships, as we called them. This allows us an opportunity to handle farm overages, but also holds an opportunity within that Medicare and Medicaid space of creating not just medically tailored or nutritionally dense frozen meals, but what is the opportunity in nutritionally dense and medically tailored grocery bags. We have our HACP Mobile, our Housing Authority of City of Pittsburgh mobile grocery bagging. So those last two programs were really aimed at individuals or corporate groups. This is a large-scale program where we're utilizing a partnership with the City of Pittsburgh. We are making grocery bags out of rescued foods and then redistributing those directly to city steps. This uses staff, volunteer time, and this program alone brings in just under $180,000 to our organization annually. Not only are we getting that food out there, this is paying for trucks, this is paying for staff time, this brings jobs into our organization, and allows us to expand our reach in a more nuanced and specific way. 412 Food Rescue is coming on 10 years. We're really working hard to breathe into the edges of this work, to understand our impact and build out nuance and depth with our eyes towards that dignity of the end recipient. This is important to us throughout our entire chain, our entire process. How are we creating something that is meaningful to that end recipient? And then finally, urban gleaning and upcycling programs. So these can be high visibility projects. They may not bring in a ton of revenue to your organization, but live in the city of Pittsburgh. Our organization is called 412 Food Rescue. There's a large number of organizations here called 412, and it is incredible to me whenever I say I work for 412 in Pittsburgh that people know it's 412 Food Rescue. We are competing against so many other organizations, but we have that amount of brand recognition within this city. And I think a big piece of that can be these upcycling programs, these high visibility partnerships that we're working with to create beers. We work with Millie's to do an ice cream collaboration. We're looking to expand that and expand the definition of urban gleaning farther than we ever had as an organization before. So we previously ran a program called Hidden Harvest, where we would look to urban trees to harvest mulberries or apples, looking to those resources. And we're looking to expand that definition of urban gleaning to be not just trees, but a byproduct of urban operations. What we know is with some of these distributors here, that I'll share the example of Wiggle Whiskey made a limoncello a couple years ago. Limoncello requires no lemon juice, it just requires lemon zest and tons of lemon zest. They reached out to us with pallets of unjuiced lemons, having no idea what to do with them. We think that this is a new definition of urban gleaning. What are some byproducts within collaborations or other initiatives happening in the city of Pittsburgh that we can then take and do something creative, nuanced, and new with? And then I want to provide a couple action steps to that, like what can you do tactically after you leave this? Just that SWOT assessment. Start to frame your potentials. Understand where are your strengths, where are your weaknesses, where are your opportunities, where are your threats, and which ones do you want to choose to begin orienting yourself towards. All of these programs that I've shared today have gone through years of iteration, but they started somewhere. They started with one conversation and then some resilience throughout that process and some sticking to it for us to figure that out. But you can start simply with a SWOT and beginning to orient yourself. A pro forma practice, these are hugely helpful. I use them constantly within our programming, whenever I speak to our development team, and it's ways for us to look at our value chain or the costs that go into any program in a lot of different ways, and then flex that to the audience that we're speaking to. Look to your value chains as humans. We do deeply human work, and that is very valuable work. So understand what are the costs that go into that, and then you can be malleable in that. You can translate that in some other ways in order to return some of that revenue. And then for your organization, define hospitality. Because we do deeply human work, what does it mean to be a hospital environment? And whenever you bring those volunteers in, bring those corporate groups in, what are you doing as a human being and that human-to-human connection that makes them go back and tell everyone else or come back for the next year or the next month?
Okay, thank you to our panel. There was a lot of information here, a lot of innovative ideas on how people are exploring earned revenue. Does anybody have any questions? I think we have a few minutes. Any follow-up questions or? Yes.
Yeah, it's a great question. When we were considering the pricing model, we definitely thought about the food disposal costs, and it's interesting. I think in New York City, we even tried to sign up as a just business trying to get a hauler and things like that just to get prices, and it was remarkable how kind of insane the pricing model of these haulers were, at least in New York City. And we discovered after going through the process ourselves, but also asking our food dinner partners, some of the small mom and pop stores would actually end up paying more than a Whole Foods just because they were situated in a back corner or an alleyway, and they had less food, but somehow they were paying more. And so for us, we were just trying to understand how do we price this, how much money can we save our food dinner partners. And we found this, to be an average of about $800 per month that, a lot of these food dinner partners, larger ones, were paying for hauling. And we, whenever we talk to food donor partners about our service, our food rescue service, we always talk about A, enhanced tax deductions, ways to get money back, but also B, reducing food disposal costs. They can talk to their hauler and renegotiate their rates because they're doing, throwing out less. So definitely, a huge component of it. I'm sure it's different per, locale, but definitely a huge, way to, save money for your food donor partners, and a really great question.
Any other questions? Yes.
There's like several questions on the online stream, so I was just going to communicate those. Maggie Baruch said, can you explain the process in urban gleaning? What happens after you receive something like multiple pallets of lemons?
So I think that's where our brand recognition comes into play. People want to work with us and understanding our mission and our value and our worth to the world. So we don't fear those big challenges because we know that we have the resilience and the critical thinking as a staff to find, we're connectors. We can work with other groups, other people in the city in order to find the best value out of them. In the case of the lemons, we began reaching out to our other partnerships. We found Goodlander Cocktails that had a problem of they have to juice a bunch of lemons, and it was really hard for them. So we could bring our volunteers. We built up the concept of doing events so that they could store and hold. So we looked for their operational gaps and looked to build a solid partnership.
It's interesting. I think also the other piece is some of these larger companies also, they have to pay, right? They can't just throw out pallets of lemons that are just, without their covers, their peels. And so, we were asking our food donor partners, like, how much does it cost? Like, and apparently it costs like $100 a pallet. So this is like a huge cost savings that, food rescue organizations are providing to these food donor partners.
Hi. So I have a twofold question. For those of you who've introduced or explored these new revenue streams, number one, have any of you faced challenges with getting your board or your staff sort of on board with the idea of going outside of your traditional revenue streams, your traditional grants or donations or whatever it is that has funded you in the past? And number two, how do you make sure then that you are, and you spoke to this with the pro forma and accounting for the de minimis costs, like how do you make sure that you're really wrapping your mind around the capacity building that then you need to do as an organization to be prepared to handle these new revenue streams? So for example, data tracking, financial tracking, et cetera.
I could start and then, 100% we've gotten a ton of pushback, right? It comes from across the board, from our food donor partners to our staff, to our funders. And I think, just to share, a bit of that, I think, we've had food donor partners who are literally actively like saying, hey, like, tell Robert that he's ruining his nonprofit, and those kind of things. And I think, I think, we want to, as any business or any organization, you want to select your partners, right? You want to choose the people who are civil and professional and the people that you want to kind of, bring with you into the new future, right? I think for funders, actually, though, a lot of funders were actually really very much on board because they don't want to keep being your, I don't know if it's appropriate to say this, like sugar daddy or whatever, right? Like they just they want to see that like you can continue to grow on your own, right? And I think like we just talking about this and like trying to make it a sustainable. Obviously, it doesn't cover all your costs, right? Like I want to be super clear about that. Like we're not for profit. If we charge the for profit rate, there would be no way our food donor partners would be doing this, right? Like. So for our funders, we did see that they were like much more on board, especially when you like explain, the rationale and the approach. And from our staff, it is unfortunate. It's very true. It is difficult. Sometimes, people do, go into the nonprofit space, looking to, make a big difference. And obviously we're making a big difference. But sometimes the approach, when you do get that kind of feedback from food donor partners who are like, I don't ever want to work with you. It just, makes it's disheartening, right? It's like, oh, then that means that, company is not going to donate their food, they're going to throw it out. So it's difficult to navigate that, and definitely explaining and kind of the rationale of like food rescue as a concept that's been around for decades and decades. And like for me personally, I don't understand why it's not the universal standard. And I personally believe that it's because there's no financial incentive. There's no reason for food donors to partners to do this. And so we have to make it obvious. We have to show them that there is a benefit. They can get enhanced access. They can make money by doing this. And so by doing that, it becomes a habit. And eventually, I hope one day I'll wake up and like, all restaurants are, donating their food, right? But that's just me. I'm just aspirational. And that's the kind of story that I like to tell, like, to our employees and our team members to ensure that they know that I'm not doing, like, why would I leave finance to do this for money? Like, it doesn't make sense. But we have had employees who would say, like, this is terrible. I don't want to, I don't want to work here. So, you have to manage, and navigate.
Yeah, from the staff end, it's always, it's hard, it's complex. People are complex. And that's why I started my presentation today with whys and values. Because whenever we bring a new program along, it's important to be able to articulate those well, why we are making this pivot that may feel unexpected or new or just simply different. Change is something us to manage through, to work through. And that's really what we depend on, what we talk a lot about operationally. Is whenever we make a change, how are we managing staff through that? And then the second half of your question, how do you account for those other costs? It's hard, and I would say we have never launched something at scale. So whenever I talk about food as medicine and orienting our Operations Good Food Project towards that next year, what that looks like is launching a partnership for us to understand impact and begin pressure testing our ideas at a manageable size, and then existing in a rethinking cycle of, well, we thought this was a great idea. Turns out it wasn't that great of idea. So we need to tweak it a little bit. So we can stay along a major path, but we're in a constant tweaking, tightening the bolts phase. But laying that foundation, you got to understand it through your pro forma. What are you tweaking? And then that helps understand, and it helps you articulate your why better.
I was getting ready to say, I think we're about out of time.
Do we have time for one more? Just short one online. This question's for Amanda, and I think the answer's probably tough to answer, but it's probably the one on everyone's mind. Can you use Medicaid waivers to pay for food rescue operations and programs? Just
Short answer, yes. So you'll have to see which waiver is being used in your state. I think the 1115 is the most glitzy one, so to speak, in terms of covering the most amount of nutrition services and being most likely to cover the services that you all are offering. But yes, the idea of food as medicine and using Medicaid dollars to pay for food is something that, like I said, the federal government is super interested in and is encouraging states to use a variety of ways to get community-based organizations like yourselves on board. And in a lot of cases, it might be work that you're already doing, and this could literally just be a new pool of clients coming into you and to your organization to get the same services that you're giving to other folks for other reasons. So I think, speaking to the last person's question of how do we get our staff on board, I think harping on the fact that you're probably already doing a lot of this work and you might need to make a few tweaks to your operations to understand Medicaid billing, which yes, it is going to be a challenge up front, but then once you get a workflow that is established and easy to use, I think a lot of your organizations could tap into these dollars. And I was talking to Josh earlier, and depending on what scale you're working at, you will be reimbursed more for providing these services than it takes you to put together these meals or these grocery boxes. So it could be a really awesome funding stream to tap into.
And the last thing for Robert and Josh, I know a lot of people are wondering what percentage of your revenue is earned income?
Yeah.
Quick answer.
Yeah, quick answer. I mean, I want to provide so much color, but right now it's 10%. Obviously we pause. We're not, going to charge people during the pandemic when they're struggling. So that's been recovering. We hope to be, back to like 20, 30%, but, we'll see.
Don't have a quick answer for you on that, but what I can say is we want it to be more. We are aiming ourselves in this direction. We think there's a lot of possibility here, and this is where our operations are aimed at the point.
That's great. Thank you to everybody on the panel. Robert, Amanda, Josh, thank you so much.